Hi guys, welcome to my YouTube channel, Don't Make Something. Today we're going to talk about hypoglycemic, which is diabetic. So we're going to talk about diabetic when the sugar is too low, what to do, and how to tell that a person's sugar is very low. So one of the main side effect of knowing that a person's sugar is very low is the person will sweat. I mean, not just sweat, I mean profusely sweat. They will start seeing the sweat on the forehead. Sometimes the clothes will get soaking wet. And sometimes they will start not making any sense. So they will say something, you'll be like, what? They'll be lightheaded and they'll be very, very weak. And most of the time, sometimes if it's very, very low, they'll start passing out. So you will see the eyes start closing and in and out. If you call their name, they'll open a little bit, look at you, and then the eyes start closing. One thing you want to do is not to let them fall asleep. You want to keep them awake. So keep calling their name. And then if you have to, keep rubbing their chest like this. Start to rub. That rubbing is going to hurt, and they're going to keep their eyes open. Keep rubbing, keep calling their name. Keep rubbing and keep calling their name. While you're rubbing, or if somebody else is in there, call somebody to the room, be like, let the person keep rubbing and let the person keep calling their name while you go and get the kit. And a Ziploc bag that this kit that every person that is diabetic should have at the bedside. This is very, very important. These 3 items will save their life. These 3 items right here. I think every single diabetic patient or person at home, wherever you are, should have this at the bedside. Because you don't want the person to be in hypoglycemic or low sugar, and you running around trying to find, oh, where's the peanut butter, where's the cracker, where's the juice, and the person is laying in bed passing out, and especially for you by yourself. So I think these 3 items, put in a Ziploc bag, put at the bedside, and I'm gonna show you exactly what these 3 items are, and that will bring up that person's sugar. Apple juice. It could be any brand apple juice, as long as it's just apple juice. Don't let it mix with anything. Or if you don't have apple juice at the moment, you can use any type of juice. The point is to bring the sugar up, and apple juice has sugar. So orange juice, not so much, but apple juice will definitely always do it. But if you don't have apple juice, you can use any juice that have sugar in it. Peanut butter. Peanut butter, peanut butter, peanut butter. I know. And cracker. Carbs. These 3 things. These 2 things. You can open the cracker and have, actually the crackers is, I got this kind of cracker. It could be any kind of cracker, but as long as it's just a regular cracker. Don't take the sea salt cracker. Just no salt. Because some patient might have diabetes and hypertension. So just take a regular original cracker with no salt in it. And have them eat it. Have them eat the peanut butter and the cracker, and then drink the juice with it. And while they're doing that, you run downstairs or at the bedside, which you should have, the sugar check. So get the machine, check the sugar while they're eating, because you want to know how low they are. So then after they finish eating, you will see how the sugar went. So check the sugar while they're eating, and then if the sugar is below 70, have them keep eating. But before you, so the first thing, they eating. You get the machine. If they finish eating, you check 15 minutes after they finish. Then after the 15 minutes, if it's still lower than 70, check again. Once you check again, it's lower than 70, 15 minutes later, have them eat it again. If it's above 70, they could stop eating. But what I will suggest is recheck the sugar an hour, because we just rushing them with the sugar and carbs in the system. And sometimes what happens is that they will crash back down. So be careful. Just because it's above 70, don't stop checking. Check an hour later just to make sure they should be on the safe side. And if their sugar is okay, it is above 70, then you could stop and the person will be okay. So at that moment, you are not giving any insulin. Or call the patient physician and for further information. I'm not a doctor. I always said in my video, I'm not a doctor. I'm a nurse with experience. So this is my experience in a hospital. And if there's and everybody might be different. So if there's a case where you give them these items and they keep dropping, call the physician or call 911 because hypoglycemic will kill a person. I'm gonna say it again. Hypoglycemic will kill a person because it brings a patient down to a coma, which is called hypoglycemic coma, where they just passed out because the sugar is so low. I mean, think about it. As a normal person where you haven't eaten all day, you have nothing in your system, and how do you feel? You feel weak, and you're not even diabetic. So they feel 10 times that. If you have any question, you can put in a comment below, and you can ask me any question you want, and I'll get back to you. Thank you.